Hello everybody, it's Tuesday. Thanks again for watching these videos. I try my best to start these videos off with something that's a bit uplifting, something that's optimistic. I was thinking today, there's this one group of people that I really need to recognize. I really need to make sure that I give them a shout out for the great job they're doing in these times. And then I was reminded that, well, if you're going to give them a shout out, you need to give this group a shout out. And if you're going to give that group a shout out, you need to make sure you thank these people because they're supporting these people who are helping these people do a great job. What I'm getting to is that it made me realize there are so many people who are doing a great job during this time and helping and supporting others who are able to do a great job during this time, that the uplifting thought for me today was, this is how it's supposed to work. This is how we're supposed to work together in times of need, and it's happening here. So the uplifting thought is thank you for supporting each other. Thank you for lifting each other up, and let's continue to do that. So let's talk about our numbers today. Currently, we've tested 328 patients positive for COVID in Norton Healthcare. That's up 20 from yesterday. We received 164 tests back. That number continues to dwindle, as you can see. We'll talk about that in just a minute. But within Norton Healthcare and our inpatient care, we now have 51 patients that we're caring for, which is up 5 from yesterday. We have 17 at Norton Audubon Hospital. We have 13 at Norton Hospital. We have 13 at Norton Women's and Children's Hospital and 8 at Norton Brownsboro Hospital. So far in Norton Healthcare, we've tested 2,609 people. We have only 180 tests pending now. So going forward, what you'll probably see on a daily basis is that backlog has worked its way through. You'll probably see 125 to 150 tests per day, which will be fairly normal for us going forward. As it relates to employees, we've now tested 550 employees. We have 74 that have tested positive. That's 1 up from yesterday. And we still have 3 in our inpatient care. So again, please continue to keep those individuals in your prayers and all of our patients in your prayers. So for the last couple of days, you haven't heard me talk much about employee health and the volume that's there. I'm just kidding. We talk about it every day, 446-2683. We want to make sure that you know that that line is available. We have about 254 incoming calls yesterday and about 180 outgoing calls. So again, people are calling in, but we're also reaching out to check with people to make sure that you know how they are and that they're able to communicate with us in a way that we can help them get back to work. So we have 353 people who are out on furlough. The good news is that's down 44 from yesterday. And the best news of all is that we have 312 people who have now returned to work from furlough, and that's up 62 from yesterday. So all of those numbers tell you that the people who are on those phones at Employee Health are doing a great job helping people and that you're doing a great job working with them. We're beginning to see more and more people come off of furlough, which is a wonderful thing. So again, that Employee Health line, 446-2683. Any questions, make sure that you have a conversation with them. Now, what I haven't mentioned much in the last couple of days in videos has been PPE. The good news is we've had some calls on that line. Remember that 446-2683 option 3. We've had some calls that have come in on that, but mostly they've dealt with questions about allergies and specifics about masks. We haven't had any calls of people who didn't have PPE, that couldn't find PPE, so that's a good thing, and we're very glad about that. Now, one thing I want to remind you about PPE, and especially masks, since we're now on the universal mask protocols, we've had some people say that we need to do a better job of making sure that we throw away those masks in the garbage cans at the end of the day. We don't want to have masks lying around on the floor, on the ground, on any of our premises, because as you know, those masks are not meant to go home. Those masks are not meant to be reused by anyone. And when you leave work that day, please make sure that it makes the garbage can. Make sure that there's none of them that are on the ground. That's just a good way to look at this. So do your best and make sure that you help others remember that as you leave every day. While we're talking about PPE, I did want to answer a question that we've been getting. And the question has been around homemade masks. And people have asked, I don't work in the hospital in a clinical area. Is it okay if I wear my homemade mask or a homemade mask to work every day? The answer to that question is yes, it's fine. Now, we have to define some things, and we need to talk about how that's all going to work. Now, we're talking about areas where you don't see patients and you're not in a clinical area. Keep in mind, the minute you set foot in a hospital, whether you're seeing a patient or not, or in a doctor's office, whether you're seeing a patient or not, you're in a clinical area. So we use the proper PPE as it relates to those areas. So let's set that off to the side and say, if you're working in a non-clinical area such as Waterston Towers, Hirschman Green, Olympia Park, the 224 building, those areas, if you would like to wear a homemade mask, it certainly is permissible. It's certainly something that you can do. We're not saying it's required. We're not mandating that you do. We're saying if that's something that will make you comfortable, if that's something that you would like to do, that's certainly fine. Many of you have seen what the CDC has said about these masks over the last few days. You've probably seen some people in groceries and other areas, a whole lot more people wearing these homemade masks. So we certainly think it's fine. Now, we've been very blessed at Norton Healthcare. We've had so many wonderful organizations who have made homemade masks and have donated them to us. So starting tomorrow in those non-clinical areas, we're going to make those homemade masks available to the employees who work in those buildings where we talked about, where it's a non-clinical sort of building. So you'll be able to get one per employee if you want to use it. Now, we need to talk a little bit about the rules if you're going to take one of those or if you're going to use it. And by the way, if you already have a homemade mask that you want to bring from work to wear, that's fine too. But please, follow these rules as best you can. Now, the first thing we're going to talk about, there's never an instance with a homemade mask where it's okay to share it with anyone else. Those masks are meant to be worn by one person, and that's you. So make sure that we don't get into sharing any of the masks. The other thing we've got to do is keep it clean. You can't just wear it to work all day, go home, put it on the doorknob, and get up the next morning and put it back on and come to work. You need to follow the directions that you've seen and that you hear about and we'll provide for you as to how you properly clean those and how you make sure that they remain clean. Now, the other thing I want to remind you of right off the bat, wearing a homemade mask, a cloth mask if you will, does not in any way get us out of following the rules. Don't fall into a false sense of security since you have a homemade mask on that you don't have to be as fastidious around hand hygiene. You do. You still have to follow and be very conscientious about keeping that hand hygiene going. Because you have a mask on that's homemade doesn't mean that you no longer have to pay attention to social distancing. You do. It's always important, no matter what. And that mask is not necessarily going to replace the need to do that. If you feel like you've got a cough, if you got a sneeze, you still need to use that elbow. You still need to make sure that you follow those same rules that we followed before we said that homemade masks were okay. And the last thing is, it's not a decision where you're saying, gosh, I don't feel really good today. I feel like I've got a fever. I feel like I've got a little cough. But because I've got this mask, I can go ahead and go to work. No, you can't. You still need to do your symptom checking. You still need to use the tracker. And if you have any questions, that line, 446-2683. But don't fall into the trap of saying a homemade mask gives me the opportunity to not have to behave the ways that we've been behaving. Because folks, let me tell you something, we've made so much progress in this community. We don't want to take any steps back. We want to make sure that we're keeping everyone safe, and we want to make sure that we are the leaders in keeping everyone safe. So again, those masks will be available starting tomorrow. They're not required, but they will be available. And anytime that we can do anything that makes you feel more comfortable at work, we absolutely want to do it. So again, thanks for everything that you're doing to take care of our patients. One of the greatest things that we can do is right back to this social distancing. And I have a picture today from the folks at Norton Brownsboro Hospital who are demonstrating how that social distancing can make a difference. And the way that that helps us, it keeps us safe and helps us keep the faith. Thanks again. We'll talk tomorrow.